Stay tuned now for Politics and Your Health with Dr. Victor Sternberg on 1460 WVOX.
Good morning. Welcome once again to Politics and Your Health, starring Dr. Victor Sternberg. He's a periodontist by trade, but you know by now he's a healer by profession. His commitment to preventive care and for the totality of your health. Once again, please welcome Dr. Victor Sternberg. Good morning, doctor. How are you today?
Good morning, Bob, on this beautiful day in September.
It's finally a fall day, and let me mention Jovan C. Richards is on the other side of the glass. We'll take calls in a little while. But first, doctor, what arrows do you have in your...
Okay, I've got a lot of arrows. I wish we could have about 2 hours, but c'est la vie. So I want to just start, before I ask questions of the audience, because I have a group of talking points. I wanted to just share with you, I tell you my patient population teaches me a lot.
Yes.
So this week we had 3 patients that were very interesting. One is a 95-year-old man who came in yesterday who is suffering from dementia, and he's been collecting Social Security and Medicare for 30 years.
Wow.
And he is failing, and it's difficult to communicate with him. And the example of this, because I see this all the time, is that this aging population demographic bomb of people that need so much care is what's causing an enormous financial drain in our society. The second patient came in yesterday. He was 98 years old. He has all his wits about him, and he's waiting to get his dental implant to replace one of his front teeth.
Hey, doctor, now that I'm one of your patients, does this mean that I'm going to live to my mid and late 90s?
My patients live... I have 60,
I'm telling you.
I have 65 and growing patients over 90.
And those are babies.
I mean, I got to tell you guys, you better take care of yourself because you may live a long life.
You probably have toys in that room for the 65-year-olds.
Well, you got it. So you're funny. And the last lady was... Remember I mentioned on the radio last time about a study involving diabetes, which when people lost 33 pounds, the diabetic symptoms disappeared. So this is my second patient, Bob, that I gave this book to from Dr. Bernstein.
Yes.
And she was an uncontrolled diabetic, as was the other one. Both of them are now no longer have any evidence of elevated blood sugar.
Any evidence?
Their blood sugars are normal. And all I did as a dentist, remember, I'm not an endocrinologist. I said, this is a book. Take it home, read it. It can make a meaningful difference in your life. The first lady's A1C, measure of diabetes, went from 13 to 6. And the second lady went from 11 to 6. And she was a diabetic all her life. So I want you to get that I, a periodontist, can have more of an impact. Not because I'm smarter than those fellas, because I take the time to say that unless you change your lifestyle, you're going to have serious medical problems. You know, and I want to point that out over and over again because, you know, I listened this week we defeated, thanks to some, you know, brave Republicans, we didn't eliminate the Obamacare program. The problem is not eliminating it. The problem
it needs to be fixed, though.
We need to deal with health care. And I'm going to throw out some questions and some paradigms that I'd like the audience to think about and comment about.
Sure.
It begins with a conversation I had with a patient this week whose mother lives in Canada. They moved to Canada a number of years ago. They went to school at McGill. And I asked them, the Canadian called me about her daughter. And I said, tell me about the healthcare system in Canada. You're now a Canadian citizen. She said, we have great healthcare. No problems. I've been here for 30 years. Everything is terrific. I said, what about waiting? She said, I have no problem. I've got good health care. I said, what about the taxation? Because I spoke to another Canadian who shared with me the following. He said that, you know, I pay 50% tax rate over $65,000 income in Canada. And the lady I spoke to said, well, I don't pay that much because I earn less money, so my tax rate is lower. Then my friend said also, and there's a 15% tax, there's a sales tax on everything we buy, 15%. So the fact that we get free education, quote unquote, and free health care, quote unquote, we pay much more in taxes.
Yes.
So let me throw that out because on one side of the coin we have Mr. Sanders and universal care, and the other side we want to kind of privatize it. Just be aware that there is an enormous cost that the Congress doesn't want to deal with, this demographic bomb. As I mentioned last week on the radio, the unfunded liabilities for municipalities that have health care promises to their employees has been raised to $72 trillion going forward.
$72 trillion?
Going forward into the future.
Mere bag of
So I'm just pointing out that The reason we haven't resolved this problem is there's an elephant in the room and nobody wants to talk about it.
Which is?
Which that the economics of healthcare, if we continue on the direction we're going, with the advances in medicine, a lack of real responsibility of the individual in preventive medicine, will result in a deficit that'll be greater than our gross national product very soon, which has dire consequences for our economy. Mm-hmm. So I want to throw some questions out. You're aware that because of the uncertainty in the Obamacare program, that states are facing a 15 to 50% increase in premiums. Whether the government will continue to fund these insurance plans, that's number one.
Now, was the government obligated to do it, or at least implicitly?
It was implicit, but it wasn't by law.
Okay.
So Mr. Trump can change that. Half the counties in the United States have only one insurance carrier because the others have left. Now, I want to ask you these questions. Are you willing, Americans who want this system paid for by the government, to have a marked increase in your taxes? Now, the way it works is those of you who receive health care, like my daughter-in-law is a teacher, mm-hmm. she pays very little for it. Mm-hmm. The school system pays most of it. If we go to a socialized system, my daughter-in-law will pay much more money. She's getting a benefit now without mm-hmm. paying for it. Mm-hmm. All the people that work for the government, all the congressmen, all the individuals that have people pay for their health care are going to have a large tax increase. The people that will enjoy this system will be the ones that don't have any health care system or have low income mm-hmm. because they don't pay much in taxes. They're not going to. So are you willing to do that? Because there's no other way around that.
But Doctor, should we not begin to think about taxing health care benefits? It's real income.
You know, I'm all for that, Bob. I mean, I myself have a health care program for myself and my employees.
But you buy it.
It comes out as a pre-tax benefit.
Right.
So I don't pay tax on mine. My employees don't pay tax on theirs. So the problem would be that if they start taxing it, their income will go down. And if somebody's making less money, it's a big deal out of their pocket.
Well, you know, when you feel it, when I was an independent contractor for a year and I had to pay for my own insurance, my good God, that was real money coming out.
Yeah, well,
$19,000 a year.
Only when you feel the pain do you really want to make a change in what you're doing.
Well, that's very true.
You know, no pain, no gain. So here's the question. I have some questions to ask. Those of you who want to replace our current system with a government for all, mm-hmm. do you really want the government responsible for a system that's now being called the VA and the post office? They're government-run programs. Mm-hmm. Are they efficient enough? Does the government have any skin in the game to make a profit? Do they care? Remember, you know that Senator Menendez was indicted.
Yes.
Because he helped a doctor in Florida, an ophthalmologist, mm-hmm. cover up the fact that he had built Medicare for over $100 million in some drug that he used for his patients, and they finally caught it years later.
How do they not catch someone milking $100 million?
Okay.
It's fantastic.
Because if somebody built Aetna out of $100 million, they have a guy there that gets paid to make sure they don't get bilked. Remember that. They have a guy there checking it.
Why the government doesn't pay people on a percentage basis to recover fraudulent monies is beyond me. Doctor, are you ready to open the telephones?
Yes, I'm ready to open. I think we have enough questions out there.
Folks, you're listening to Politics in Your Health, starring Dr. Victor Sternberg here on 1460 WVOX and worldwide on WVOX.com. We're each and every Friday at 9:03 on the button. Listen in. Mitch is on the phone. You can call 636-0110, but we go to Mitch first. 636-0110. Mitchell, you're on.
Hey, some great questions, but before I answer very quickly, you have a 98-year-old and a 95-year-old patient, and Bob Marrone is still your oldest patient?
But you see, there was no need to go there.
Listen, first of all, may I answer the question? Your question is yes, and yes, because your daughter, who has most of her insurance being paid by the school system. If we went to a taxation field, that school system would have a lot more money, so your daughter would be earning a lot more money, and the taxes she paid, since the really upper income people would be paying a larger portion, she wouldn't be paying as much in taxes as she would get an additional income. So she would actually be benefit in a system like that. So the answer is yes, and yes. But I do have a question for you about responsibility, because it's something that's really bothered me. In the past month, my doctor has taken me off 2 medications for various reasons. both times it was right after I filled both scripts. These are very expensive medications. The combined value of the two of them is well over $1,000. They basically is 1 month's supply. It is killing me that I can't give it back to the pharmacist. Now, fortunately, my wife has a good insurance plan, and it really, our co-payment was negligible. But I don't understand why I can't give it back to the pharmacy, and they in turn could give a script of a 1 month thing to someone who has no medical insurance and would have to pay out of pocket the hundreds and hundreds of dollars for this. And if everybody was able to do that, think about, because many of us get medications and, after at some point the doctor says, stop.
Well, there's no free lunch. Somebody's still going to pay for it. And I understand,
But it's already been paid for. So.
Well, you know what? It's if you had paid for it out of your pocket, if you paid all that money out of your pocket, you'd want your money back.
If I paid for it out of my pocket, I'd be upset. But if I no longer could use it,
he wants to be able to give it back.
Why shouldn't someone benefit from it? It's like me buying a suit. I gain weight, no longer could wear the suit. I give it to someone to benefit from it.
Well, let me reframe that question, if I might, at least distill it down. Doctor, is there any or are there any programs where drugs can be given back?
No. Unless, as far as I know, unless there is an issue with the doctor indicating that this drug is no longer necessary, or if you have an adverse reaction to it. I've had issues where I've given drugs back for reasons like that, and the pharmacy refunded it to me. But as far as giving it to somebody else, I think you're getting into an area where you can get some problems.
No, but doctor, I totally agree. But what I'm saying is you give it back to the pharmacy, and because the cost of making pills is negligible. Right. So they in turn they've made their money. Now they could give that dosage to someone who just doesn't have a medical.
I would like to see you fight the lobbyists on that one, Doctor.
You know what? I brought up last week the issue of the whole drug problem is controlled by big pharma and by the middlemen, and it's the special interests that keep the reason it won't happen, Mitch, is because special interests will not let it happen.
Okay, we got to take another call. Mitchell, thank you very much. It is 9:15. We go to Louise. Louise, you're on with Dr. Sternberg.
Good morning, Louise.
Good morning, Doctor. Again, I enjoy your program. It requires critical thinking and ethics. There is no legitimate, I'm not one for absolute, but I'm certainly leaning to this one about the issue of health care in the United States without attacking and attaching all the other parts of the budget of the federal budget to cure the issues, the illnesses and corruption in healthcare. You need to also take away from the military budget. You need to take away from from the criminal justice budget. You need to take away from every budget, whether you approve of that organization or not, to fund healthcare as a priority in the United States. That healthcare must be protected, and if you protect healthcare, which includes mental health care, because as we spoke a few months ago, and that there's an epidemic of mental illness in this country, that we deal with that, we can start solving it because we won't have as many crimes. We won't need the military. We'll always need the military, and it's important.
Luis, I want to give the doctor a chance to answer. Now. Okay, thank you very much for the question.
Luis, it's an interesting question, and I'm not denying the fact that we have to spend more. The question I have is that we already have this huge expenditure for Medicare, Medicaid, and the VA. And if you add private insurance in, we're spending about $3 trillion already, which is a huge percentage of our budget. In Canada, where they don't have a large military budget, they don't have thousands or millions of people in prison, the taxation rate is 50% with a 15% VAT tax. They don't have those expenditures. So, the reality is that regardless of how you take the budget, the healthcare costs are escalating, and you, the citizens, have to pay more taxes if you want this system, regardless of what we do with the other programs.
It's interesting. We go to another caller. It is 9:18. Anthony's on the line. You're on with Dr. Sternberg, Anthony.
Good morning, Anthony.
Good morning. How are you? I could give you a lot of examples why I wouldn't want the government making decisions for me for health care. We can use the post office, but I want to give you an actual one that's occurring as we speak. It's an 87-year-old man in a nursing home. This gentleman spends every day in a wheelchair for most of the day, or flat on his back in bed. He gets out of the wheelchair for about 30 to 45 minutes just to keep a little active in a nursing home. He now has 3 spots on his face and his head that they've taken biopsies on, and they tell it's the very beginning of skin cancer, and now they're going to do surgery. Now, does this make any sense? You tell me. You're going to put an 87-year-old man who is just about an invalid through surgery for something that clearly he would probably die from natural causes long before skin cancer ever got him?
Well, doctor,
I think that's a good question, and I was going to ask another question. Should government decide how much money they're going to expend to extend life or let a person die? And this is let me give you the flip side of that. I think there's value in your discussion. You get into this idea of death panels, and other very complicated ethical issues.
Well, I believe in assisted suicide, I'll tell you that. Okay. And I also believe there's a big difference between life and quality of life.
I agree with you. The question is, here's the ultimate question. Who is going to decide that? My friend has multiple sclerosis. He is a former periodontist. He's in a wheelchair. He can't even speak. He's taken care of by insurance. His wife is his caretaker. Now, should we stop? He's a very valuable member of the family. They love him. He loves his children. He can't move or speak. He wants to live, and his family wants him to live. Should we cut him off?
No.
I'm throwing this out as an ethical question.
I'm sorry. I
agree with you, but what I'm saying to you is I don't want the government making that decision. That's my point. If the family wants to make it and the family wants to keep him alive, that's one thing. That's their choice.
That is
if he's expressed clearly his wishes before he was in this position, then whatever those wishes are should be followed.
I'm not saying the government should. I said, should the government say, if you want to keep him alive, you bear the expenses. We will no longer pay for it.
Anthony, great call. We got to run to another guest. We got a lot of callers today. It is 9:20. You're listening to Politics in Your Health, starring Dr. Victor Sternberg. The call-in number 636-0110. Chris, you're on with Dr. Sternberg. Good morning.
Good morning, Chris.
Yeah, good morning, Doc. Good morning, Bob. I'm wondering, hearing the conversation, is it possible to completely distinguish private health care from public health care? Like, I heard you mention the VA system. Suppose, like, the public system, like the VA was expanded and people who couldn't afford private, I'm using the school model a little bit,
right,
but people who couldn't afford private care went to a public care facility.
I think that's, Chris, I've brought up the possibility of the fact that we should have Medicare available to people who have illnesses that are pre-existing conditions where they can pay according to their income. The question is, do we go to a total government program? Do we go to a choice, a public option, in addition to private insurance?
I was more talking about a facility, like, in other words, a medical facilities that deal strictly with public.
You mean like
health
a clinic?
Like a clinic. We have that in Westchester. We have open-door clinics for people who don't have insurance.
They're going to lose their funding, by the way.
I mean, Chris, you make a good point, and it all comes back to the issue of how are we going to have the money, and what do we request of the population in terms of more taxes to make this happen? And the big questions are really more important than the details. So let me ask you another question, Chris, because you're on the are brain dead people or people in irreversible comas entitled to health care?
No.
And I want to ask that because there are literally tens of thousands of people that fit that qualification are laying in a bed with a respirator, and it's costing umpteen dollars. Should we pull the plug? Or should we ask the families to take care of them? Or the gentleman who has discussed a nursing home individual, why isn't the family taking care of the gentleman? Should we request families take care of people?
Are you talking about someone who hasn't made a designation?
It hasn't made a designation, and they're sitting on a respirator, and we can't pull the plug.
But there's no one else that will assume interest for that person?
Or the family says, we want them alive.
Well, give an answer to the doctor. We want to move on to other callers, too, Chris. Go ahead, Chris.
Should they get health care?
Yeah, well, I think there should be a panel, then an independent
panel. Ooh, a death panel.
Well, I mean, if there's no one that's willing to assume the interest or the responsibility, and the person hasn't done it himself, then it should be in another entity should make the decision.
All right, we're going to go to another call, but thank you, Doctor. Answer his question, and then we'll go to Mel from Chappaqua. Go ahead, Doctor.
Remember Terry Schiavo, the girl who was brain dead, And when they finally did the autopsy, her brain was shrunken, but it caused...
It was liquefied.
It had to go to the Supreme Court. We had all kinds of discussions about the right to life, and this girl was irreversibly brain dead, and yet it tore us apart.
Do you remember the doctor who was pushing that she be saved?
Yeah,
he was a Senate leader.
Yeah.
I had him on my show. One of the biggest dimwits I've ever had. I don't know how he became a doctor. He should have stayed a senator and stayed out of the business. Mel from Chappaqua, you're on the air.
Good morning, Mel.
Good morning. How are you today?
Good. Thank you, Mel. Appreciate it.
I have to tell you, I'm working at home today, and before I even turned on my computer, I accessed the show online so I could listen. So great reception through one of the online apps, and this is my Friday. This is my Friday guilty pleasure.
Wow,
listening to your show.
I'm glad to know I'm somebody's guilty. Well, at least a part of the guilty pleasure. What's your question for the doctor?
Mitch brought up something regarding the medication, how it infuriates me as well, how you take someone who has an ailment, the doctor prescribes the medicine, and for whatever reason the patient, can't use it, allergic reaction, it doesn't work, but they already bought like a 30-day supply or even a 7-day supply. So my thought, even though it's probably not going to work, is the doctor will give the patient like a 2-day supply to try it out as part of the 30-day supply. So they say, okay, here's like a sample. They say if it works, then you'll fill the rest of it, the rest of the prescription. And if it doesn't work, we won't fill the rest of the prescription, because since the other 28 days of the prescription are still at the pharmacist, this way it's not tainted, and you can sell it to someone else. But of course, having the patient go back and forth to the pharmacy or having it delivered, that could be very difficult. But I think that might be something that might work.
Doctor?
Mel, everything you say is very valid. The problem is, follow the money and look who's interested in this program. It makes too much sense, and therefore, I hate to say this to you, it won't happen, because the vested interest on the other side have too much to gain or lose. I want to ask you another question, Mel, while we're on the phone, regarding health care. Do you believe that our government is competent enough to adequately run health care and make it work?
No.
Okay. And the second, let me give you a quick example. I spoke last week while I was in Boston to Bob, that my doctor, who's a cardiologist, the first time I've seen her, said, why don't you get a stress test? You're really in good shape, but we'll get a baseline, and you'll probably break the machine because you're in such good shape. And then she said to me, but Medicare doesn't require pre-authorization, so go get it, and the doctor will run the test. She'll get paid. She'll get paid.
It's free.
So I'm going to tell you, the way it would work for me would be, she'd say, listen, a stress test might be nice. It'll cost you $1,500, Dr. Sternberg. How would you like to pay for it? I would say the following. I say, you know what? Do I really need this? Is this absolutely necessary? She said, not really. So I said, you know what? Let's pass. When you pay out of your pocket, you have thoughts that may be different. When you don't pay out of your pocket, let's go do a stress test. That's unfortunately too much of a reality.
Okay, thank you very much for the call,
Thank
Mel.
you, Mel.
We go
Appreciate
now
your listening.
to Ritchie. Ritchie's on the line. Ritchie, you are on with Dr. Sternberg.
Good morning, gentlemen.
Good morning, Ritchie.
Doctor, one of the things I had another point I wanted to make, but one of the things I'm sitting here thinking is that as a dentist, and there really is no, dental insurance.
Correct.
Anything that's there is negligible.
Correct.
You really charge according to, whatever, I guess, you want to charge.
Correct. Well, I have to be reasonable, but just to correct that, I have to make it affordable to my patients and valuable enough to run a private practice, pay my employees, pay the rent. There is, just to give you an idea, I want to just the reality is that I have to also, survive financially for the people I support. But go ahead.
Absolutely, and I'm, not negating that in any way. It's just that, what's happened now in medical offices is that trying to work with these numbers that, the doctors are paid is so difficult.
Yes.
What's coming back from the insurance companies.
Yes.
Young doctors who have, are saddled with hundreds of thousands of dollars in loans, things like that. It's quite difficult. And it's interesting, though, that, as a dentist, it's, I guess it's a little bit more freeing in terms of the ability to...
Well, good, great call. Let's let the doctor answer.
Yeah.
Richie, thank you very much for the call.
So listen, this is a strange situation because people will come to me and spend thousands of dollars to have some teeth replaced. But if they went to their physician, they said, I want you to do this test. You're going to have to pay for it for $150. They say, my insurance is not covering it. Forget it. There is a mentality on one side that health care is an entitlement and dental care is a choice. And, my generation of dentists, I'm going to tell you right now, when I leave and people who I went to school with leave, it's not going to be the same because they're straddled with so much debt and insurance is such a big part of it. The quality of care is going to diminish. And my last question, just to quickly deal with this, is the physicians. As physicians get paid by Medicare and Medicaid, their reimbursement is so low because the government wants to keep its costs down. Mm-hmm. The doctors are being squeezed.
Yeah.
Men do not want their children to go into medical school. Because of the cost of education and the reimbursement at the end is so diminished that unless we rethink this, that who pays for medical care, how do doctors pay it back, and how are they going to get reimbursed, we're not going to have a very powerful medical establishment in this country.
We are not. Doctor, it's time to give out your bona fides. Jovan C. Richards on the other side of the glass, thank you very much.
Thank you. Thank you, Bob. It's Dr. Save My Teeth, Dr. Sternberg in Briarcliff Manor. And this show is being videotaped, so you can all watch it online. And we look forward to hearing from you next week.
Do we want people to actually see us now?
Well, it may be the end of our career, Bob.
Oh,
this
my
could be
goodness.
the end. Or the beginning.
We have faces for radio, but we are this. You've been listening to Dr. Victor Sternberg, Politics in Your Health. We're here each and every Friday at 9 o'clock, actually 9:03 to be precise. Thank you very much for listening, and please stay tuned for our Preparing for Your Future with Rosemary Cameras coming up. I'm Bob Marrone. Thank you for listening. Have a wonderful day. It's a great fall day out there.